Hello everyone, welcome to another video. So in today's video we'll be looking at a different topic. So in the previous video I think we treated migraines. So today we're going to be treating tension type headaches. So basically tension type headache is actually the most common type of headache, and it's called a tension type headache because it basically feels like a tight band or there's like something that is causing pressure, like a lot of pressure around the head. So, or it could feel like a tight band is really being wrapped around the head, especially in areas like the forehead, the sides of the head, or the back of the head. So that's why it's particularly known as tension type headaches. So this kind of headaches, they are often mild to moderate in intensity, and they are usually not worsened by movement, unlike you usually see in migraines. So think of it like a headache that you usually get from stress, or from poor posture, or from tiredness or fatigue, or even from eye strain. So the headache you get from all these things, it's basically known as tension type headaches. So tension type headaches, they are sometimes actually known as stress headaches, and they are not usually linked to any serious disease or serious brain disorder, and they can usually be episodic, that is occasional, or they can be chronic, that is like happening frequently, maybe more than 15 days in a month or for 3 months. So looking at the anatomy and the physiology. So basically, to understand tension type headache, here's what basically happens. So the scalp, the neck, and the shoulder muscles, they become tense or tight. So this tightness stimulates pain receptors in those areas, and usually when it stimulates these pain receptors, so signals will now be sent to the brain, and then the pain is perceived around the head. So there is usually no structural damage or inflammation that occurs, basically just an overactivity of the pain pathways. So it's not a serious condition, and usually the key parts involved are the pericranial muscles, that is the muscles over the head and the neck, the trigeminal nerve, that is the main sensory nerve of the face and the head, then the serotonin and other neurotransmitters, which may also be involved, but their role is less clearer than we see them in migraines. So what are the triggers, like what causes tension type headache? So number one, stress or emotional tension. So stress is the number one factor that causes tension type headaches. Then poor posture, like sitting hunched up at a desk, or looking at a phone and just sitting hunched up, so it can also be a trigger. And then lack of sleep, because usually whenever I don't get enough sleep, like the following morning, I usually have this pounding headache, like especially after I have my morning meal and I come to work, then like after a while I start having this kind of headache. So it's usually because I usually get them when I don't have enough sleep. So lack of sleep or having irregular sleep, basically. Then eye strain, when you are looking at your screen for a long time or unnecessary amount of time. Then fatigue, hunger. Hunger is a major one. I don't think there's anybody that doesn't get headache whenever they are hungry, like intense hunger. So fatigue, hunger, caffeine withdrawal too, or caffeine overuse can cause tension type headaches. Then anxiety, depression. So all these are the common triggers of tension type headaches. So for the pathophysiology, so in tension type headaches, there's increased muscle tension around the head and neck, and this causes activation of the pain sensitive areas like the scalp and the neck muscles, and there is usually no inflammation, no swelling or bleeding, just a functional overreaction of nerves. So the nerves are being unnecessarily, how do I put it, they are just putting too much attention on themselves, like they are just overreacting. So it's just it. And in cases of chronic tension type headaches, the something known as central sensitization may occur, and this means that the pain centers in the brain become more sensitive over time, making the headache more frequent. So this is what usually makes tension type headaches to be chronic. So looking at the signs and symptoms, we are going to look at the pain quality, like how is the pain like. So the pain is usually dull, aching, pressing or tightening, not usually throbbing like we see in migraine. And then location, so the location is like the forehead, the sides of the head, the back of the head, sometimes the neck. Then intensity can be mild to moderate and not disabling, like it won't disturb you to the point that you won't be able to like function properly. So the intensity is mild to moderate. Then the duration, like 30 minutes to several hours in chronic cases, daily. Then other symptoms, like there's usually no nausea or vomiting. We usually see that in migraines. Then there's usually also no photophobia, no light sensitivity, no sound sensitivity. Then with unlike migraines, with physical activity, tension type headaches, they don't become worse. So physical activity doesn't worsen the pain of tension type headaches. So other types of headaches to rule out when we are trying to distinguish the symptoms with tension type headaches. So other kinds of headaches that we could rule out when we are diagnosing if someone has tension type headaches. So for example, migraines. So for migraines, they are usually one-sided, they are throbbing, and they come with nausea and light sensitivity. So this is how to distinguish migraines from normal or tension type headaches. Then cluster headaches too. Cluster headaches are more severe, they are one-sided, and they are usually around the eye with and they usually come with tearing or nasal symptoms. Then when it comes to sinus headaches, so they are usually accompanied by nasal congestion and also facial pain. Then headaches that occur due to medication overuse, they happen from taking too much painkillers. So if the patient maybe tells you that they've been on excessive painkillers, so that could also be a factor that okay, this could be a headache due to medication overuse. Then we also have cervicogenic headache, which usually originates from the neck, like from neck disorders, and is usually linked to cervical spondylosis that we talked about in the most recent video. That is like basically osteoarthritis associated with the neck. So looking at the diagnosis of tension type headaches, when we're diagnosing, is based on symptoms and history. So particularly symptoms, because we have to rule out like other kinds of headaches that might be in play here. So there is usually no specific test that is needed unless the symptoms are like unusual, like not the usual kind of symptoms you are supposed to get from normal headaches. Then some red flags could be like sudden severe pain, neurological signs, or headache that wakes you from sleep, which usually needs further investigation. But besides that, there's no specific test that is needed to diagnose tension type headaches. So for the treatments, for looking at the non-pharmacological approach, so we could advise the patient to manage their stress levels, like maybe by meditating, doing meditation, deep breathing exercises, cognitive behavioral therapy. Then also like lifestyle changes, like having regular sleep. And if you cannot sleep, if you're having issues with sleep, like could also recommend some sleep aids for the patient to help with this lack of sleep. Then also hydration and having regular meals too, not skipping meals or going long periods without meals, because like I said, hunger is a trigger for tension type headaches. Then there's something known as ergonomic adjustment. So this has to do with like the fact that we can get tension type headaches due to poor posture. So trying to get, like, if your poor posture is due to maybe the kind of seats you are, the kind of how they put it, the kind of sofas that you're always sitting on, or just trying to get like correct chairs or correct tables like in your workplace. So this is what this is basically referring to. Then physical therapy too can help, like stretching the neck and shoulder muscles. Exercise too is very good. And also this cold or warm water compresses to ease the muscle tension. So looking at the medications we can give when a patient has tension type headaches, so number one, we could give analgesics like paracetamol. I think paracetamol is the gold standard that is always given when a patient has headache. And we can give paracetamol, we can give NSAIDs like ibuprofen. So it's usually first line and it's usually used in short term, it's not used in long term. Then but the problem is that these days people abuse paracetamol. People just take paracetamol anyhow because paracetamol has a large margin of like safety and all, but using it long term still has like the side effects. It can cause like liver toxicity and all those things, but nobody wants to hear about that. So we could, besides analgesics, we could give the analgesics in combination, like paracetamol plus caffeine, which is effective, but there's a risk of overuse, like I explained. So we could also give muscle relaxants like tizanidine for muscle tension related tension type headaches. Then we could give antidepressants like amitriptyline in low doses for chronic tension type headache prevention, and some anxiolytics like benzodiazepine, which is avoided in long term due to dependence. So for the management and prevention of tension type headaches, we have to limit the excessive use of painkillers, like no more than 2 to 3 times a week, to prevent like rebound headaches. Then managing of stress, staying hydrated, staying well rested, trying to do regular physical activity. So that is basically. So tension type headaches, they're usually not dangerous. They can affect quality of life only if frequent, but they usually respond well to like lifestyle changes and simple medications. Like if you just take simple paracetamol for tension type headaches, is usually enough for that condition. Like within like hours you are back to yourself, you're okay. Then but it's also good like if it's accompanied with lifestyle changes, because if it's not accompanied with lifestyle changes, you would take this medication and the headache will keep reoccurring, and you keep taking this medication. But usually that's the thing that people don't understand. Like if you are doing something in your daily life and that is causing the condition that you're having, sometimes the medication is usually not enough, because medications have like this how do I put it, they have like this amount of time that they have, that they can work in the body. So after they've done the work for this amount of time, so they are and they've been excreted out of the body. So if you don't hit to like lifestyle, if you don't change the way you've been approaching certain things, that condition can come back even after you've taken the medication, because the medication has left you and it's now up to you to like help yourself. So if you are just taking medication and you're not trying to help yourself, then nothing is even really, you're not even doing anything. You're just taking, like, in fact the medication could be like a placebo. So that's basically it. Medications have to be taken together with lifestyle changes. And then usually chronic tension type headaches, they may take longer to control, and they may usually need long-term preventive treatment. So that is basically it for this topic. It's a very simple topic, very straightforward, because it's one of the most common conditions. So that is basically it. Thank you for watching this video. See you in the next video. Bye.